If you have been trying to get pregnant for a while, there are various factors which could have been preventing you from achieving that. I've talked about some of them in my previous videos, but in today's video, I'm going to be telling you one particular thing that has made it difficult for a lot of women to get pregnant. However, many of these women do not know about it, and it is called hyperprolactinemia. So in this video, I will be telling you all about hyperprolactinemia, what it is, the causes, the signs and symptoms, and the diagnosis, and finally, how it can be treated. So if you would like to know about all of these, keep watching while I explain them all to you. But if you see me for the first time, my name is Peace Tracy. I'm a registered nurse and midwife, and I currently practice with NHS in England. If you enjoy this kind of content, please give me a like as you watch and subscribe to my channel, because here we talk about fertility, women's health, and everything health. So let's get started. So let's begin by talking about what hyperprolactinemia means. So hyperprolactinemia simply means when there is an abnormally high level of prolactin in the blood. That is the simple explanation of it. Now, prolactin on its own is a polypeptide hormone, or simply put, a group of hormones that is produced by the anterior pituitary gland. Now, this hormone has various functions, but its major and primary function is to support the growth of breast tissue and to help in the production of breast milk, especially during the time when a woman is pregnant and during the time she has just given birth. That's the postpartum period. So that is the major function of this hormone known as prolactin. It supports breast milk production to ensure that the baby is well fed and nourished. Now, when we talk about hyperprolactinemia, how is it related to infertility, as I mentioned in the introduction of this video? Now, this hyperprolactinemia has various causes, and we are going to be talking about these causes now. Before I tell you more about the causes, it's important that at this point I explain to you that this hormone prolactin has 2 to 3 times higher amount of secretion at night compared to the day. So it is more higher at night when you're sleeping than in the day. So now let's talk about the causes. Now there are various causes, but I will now categorize it into 2: the physiological causes and the pathological causes. So when I talk about the physiological causes, I mean something like the sleep, exercise, pregnancy, stress, lactation, and sexual activity. So these are the physiological causes of hyperprolactinemia. Now, the pathological causes are those causes that will now bring about the signs and symptoms I will tell you later. So these physiological causes really do not produce those signs and symptoms that we see and we now begin to get worried about someone having hyperprolactinemia. I don't know if this makes sense. So having, high level of exercise, stress, lactation, pregnancy, truly they can increase your prolactin levels, but they do not bring about the following signs and symptoms, which I will be talking about. So what are these pathological causes of hyperprolactinemia? Regarding the pathological causes of hyperprolactinemia, one major cause is what is called prolactinoma. So what is this prolactinoma? This prolactinoma is a prolactin producing tumor of the pituitary gland. Now, the exact cause of this prolactinoma is unknown, so it is actually a tumor of the pituitary gland. But this tumor, the good thing about it is that it is a benign tumor. It is not cancerous at all, and it has been seen to have a very slow growth rate. It grows very slowly, and also sometimes it seems not to grow at all. However, in a vast majority of people that it has been found in, it has been seen that majority of those tumors are usually less than 10 millimeters in diameter. So it's usually a small tumor, and it also occurs both in males and females. And actually, when we talk about the signs and symptoms, those with this hyperprolactinoma in males and females, they have slightly different signs and symptoms. Under these pathological causes, other things that can lead to hyperprolactinemia are acromegaly, Cushing's syndrome, hypothyroidism, renal failure, liver failure, and certain medications like anticonvulsants, some antihypertensive, some H2 beta blockers, antidopaminergic, and antipsychotics. Some of these medications can lead to hyperprolactinemia, and these are under the pathological causes. Let's talk about the signs and symptoms of hyperprolactinemia. One thing you should know that this situation affects both males and females. So I'll be dividing the signs and symptoms into two for the males and females. So ladies first. For the ladies, they usually present with abnormal period, that is absent period rather, no periods at all, or irregular periods. Then another sign the ladies present with is milk discharge from the breast when they are not pregnant or breastfeeding. So if you are in a situation whereby you're having a milky discharge from your breast, you're not pregnant or breastfeeding, it's time to go see your doctor and go, get checked out to find out the exact cause. Then another cause or another symptom in the ladies is decreased bone mass, and also they also have things like headache. Now, these are the signs and symptoms you find in a woman. Then for the males, the major signs and symptoms are erectile dysfunction, decreased libido. They also experience visual disturbances, decreased bone mass, just like in the females, and headaches. So these are the things that the males experience. Then I also forgot another sign that the males, experience is gynecomastia. That is when there is an increase that is it, an increase growth of the breast tissue. So there is, abnormally large size of the breast tissue. It could be in one breast or both breasts. So let's talk about the diagnosis of hyperprolactinemia. So when we talk about the diagnosis, it simply means what kind of test can you do to know if you have hyperprolactinemia. Now, the major way it is diagnosed is through a blood test. And in the blood test, it simply means taking blood samples from your vein and testing for the prolactin levels. Now, for the males, we have a range both for the males and the females. For the females, it is between 59 to 619 international units per liter. And then for the males, it is between 45 to 375 international units per liter. So when you get the result, you just give it to your doctor. They will know how best to interpret it for you based on your sex and your specific circumstances. And also, sometimes they also run tests to check for your thyroid stimulating hormone levels. The second way for diagnosing hyperprolactinemia is through an MRI of the head, magnetic resonance imaging of the head. So in this situation, doctors are looking out to see if there is anything like a prolactinoma. Remember, I talked about prolactinoma earlier. So that is another way of finding out if you have hyperprolactinemia. So that is it for the diagnosis. So what about the treatment? Now, if you've watched up till this moment, thank you for watching till this moment. But please kindly give me a like and subscribe to my channel. Now, the treatment of this hyperprolactinemia is dependent on the cause. Now, remember I mentioned antidopaminergic agents as one of the causes of hyperprolactinemia. So you can use dopamine agonists as one of the treatments. And how it works is that it simply reduces the production of prolactin. The next one is through the use of surgery. So simply put, here, there is a tool that is used to insert it. They usually cut the nose, use the tool to insert into the nose, and then they get into the sphenoid sinus and then remove the prolactinoma. And then the next one is the use of radiation therapy. So when surgery fails, the use of radiation is used to destroy these tumors. The final treatment is called temozolomide. So when surgery, the use of dopamine agonists or the use of radiation therapy fails, this is an alternative treatment. So thank you for watching till the end, and I really appreciate all your likes, all your comments, and everything. Thank you for watching. If you got any question regarding this, kindly leave that for me in the comment section, and I'll do my very best to answer it. If you have other topics you would like me to discuss, please kindly leave them for me in the comment section. Thank you for watching, and I'll see you in my next video. Bye for now.